Senator Kaine.
Thank you, Mr. Chair, and thank you to the witnesses. I want to particularly recognize Dr. Kaine. I know you're very well prepared for this hearing today because one of the leaders that's with you, Kristen Malloy, used to be on my staff, and she made sure I seemed a lot smarter than I was at any hearing that I attended. I think I want to focus all of your attention on the workforce issues because I'm on the health, education, labor, pension too, and if I go to my hospitals and healthcare providers, they're singing the blues about workforce, tight labor market, difficulty hiring and retaining folks. I went to the grand opening of a new VA clinic in the Fredericksburg area 2 Fridays ago, and we built it to the tune of about $350 million. And we built this state-of-the-art clinic with one step down from a hospital because there were multiple clinics in the area, and veterans were having to go from pillar to post to get care rather than a single place. But when we opened it, and I was there for the opening, I had staff say, we're on a skeleton crew. The 3 VA hospitals in Virginia, Salem, Richmond, and Hampton are laying people off. There's hiring freezes. There's plans for even more layoffs. And so the estimates I was getting at that grand opening is they're probably 20 to 50% staffed. There's another sizable clinic similar that's going to open in Chesapeake, supposed to on April 11th. If it does open on time, I'm suspecting that it will be a similar thing. And you saw the announcements about more cuts coming in the VA. What is your vision for how you've talked a little bit about the need to be more integrated between DOD facilities and VA facilities, but then also on the civilian side, what is your vision for how we equip our civilian system to provide a surge capacity or backup capacity when we need it to perform well in combat situations? Please, Dr. Kaine.
Senator, thank you for your very insightful comments and questions. I am a veteran. I get my care at our VA in Philadelphia. My wife is a primary care physician and takes care of veterans. So I can speak to your comments about the VA from that perspective. I do have a role at Penn Medicine as the Assistant Dean for Veteran Affairs for Penn Medicine, but I'm quite new in that role and still learning the ropes. So I'll speak more from my end user experience. I would say that certainly there are opportunities for synergy. The partnerships between VA facilities and academic medical centers, I think, have been partially realized, but in this sort of urgent situation we find ourselves in, we need truly a whole of society approach, and where there can be market synergy, where there can be economies of scale, we should aggressively pursue that. I know that our CEO, Kevin Mahoney, has made overtures to the VA, and there have been agreements signed between the VA. I don't have detailed knowledge about that and where that stands, but I think there is an opportunity, and we should push for that. And as a veteran who receives my care, I hope that we can continue to deliver excellent care through better synergy.
How about Dr. Friedrichsen, Dr. Robb?
Thank you, Senator Kaine, and that is a beautiful facility, and it'll be tragic if it sits there empty while veterans are unable to access care because of shortages of medical professionals in the VA, in the DOD, and in the civilian sector. We're in a less than zero-sum game right now, and that is both a health security issue but also a national security issue. The first recommendation I would make to this committee, direct that the Department of Defense does not close any more of our military training programs. For decades, the military training programs have been one of the pipelines that when people eventually left the military, which all of us do, they go to the civilian sector. We cannot afford to close any more training programs when we have so many shortages of doctors and nurses and dentists and other things. The second, I implore this committee, in the NDA, direct the DOD and in partnership with the appropriate VA oversight committees, the Veterans Administration, to come back with a plan, starting with the DC market, to integrate the two systems. We've talked about this since I was a major. I moved here in 1997 and we were talking about this. It's time to stop talking and start doing it. We can't afford to keep talking about this problem. That hospital in the VA here is ancient. It's got to be replaced. We just finished a $1 billion upgrade at Walter Reed. Why in the world are you not demanding that we come back with a plan to do that? It is more efficient and it helps to pool the resources. The third point, and the most important one in your health committee role, is we must address these pipelines as both a health security and an economic security and a national security concern. As long as the pipelines continue to be insufficient to need, there's no way that any of these problems are going to get fixed. And I think you have a unique opportunity to help bring that into both committees. Thank you, Senator.
Thank you. And Dr. Robb, I'll ask that question for the record because I'm now out of time. I yield back to the chair.
All right. Actually, these witnesses will not be taking questions for the record, but I'll let you follow up for 45 seconds.
Dr. Robb, then could you approach that workforce integration question too? Thanks.
Yes, and I'll go back to where we can share resources. And I will foot stomp. We have very many successful joint DOD and VA partnerships. Travis Air Force Base is a great example where the actual VA is inside of David Grant Medical Center, share staffs, but more importantly, share patients. We have other where we're co-located community-based outpatient centers that feed patients into like Anchorage, Alaska. We see that down there at Naval Pensacola. So those opportunities, because usually what happens is we want access to critical care patients, okay, for our proficiency, and the VA wants access to resources, which is either excess capacity on space or in staff. And so I think that continued movement forward, not always one size fits all, but that is very, very important. Much like the VA is at all the academic health centers, I think the Department of Defense, especially in our 6 or 8 strategic places, need to have strategic VA and strategic MilSIV partnerships, sharing staff. And I will quickly say, not only do we learn from the military, the military learn from the civilian opportunities. During OIF and OEF, actually, the American College of Surgeons made sure that they were with us so they could learn firsthand, real time, on how we were treating. So it is a mutually synergistic relationship.
Thank you, Dr. Robb.